connection. If it is your turn, only then you are supposed to answer. There is no negative marking that is there. The questions will not be forwarded in any form. Okay, you want to answer the question, you can, but there will be no extra points given. Okay, so shall we start? I hope I'm audible to everyone. I will be taking your team's name. So let's say, for example, question 1. So round 1, I will read the rules. I will start with the question reciting. Okay. So question 1, I will take the name of the team, that is team A. Only then you will unmute yourself and answer the question. You are supposed to answer only once. Whatever answer you are giving first time, that will be considered. Okay. Okay. Okay, let's start.
Excuse me, ma'am.
Yeah.
Ma'am, do we have any time limit and can we discuss it among the
Yes, for every
group?
round, you will get some time to discuss and answer. For with each subsequent rounds, you will understand that. Okay. One more important thing, all your points for each round will be carried forward. Okay. So the team with the less amount of points, okay, after each round will be eliminated. Okay, once you have been announced that this team is eliminated, make sure that you leave the meeting immediately so that there is no confusion for us. Okay, is it understood? Are there any questions? I'm sorry, I forgot to introduce myself. I am Dr. Amrita Ekbote. I'm assistant professor in Sancheti College of Physiotherapy, and I will be your quiz master for the day. Okay, so shall we start? Is the screen visible to you all? Is the presentation visible? Can somebody just unmute themselves and say yes or no so that I can understand? Yeah, anyone is fine. So today for group 4, we have 5 teams. Team A is from, okay, we'll not just, let's just keep it anonymous. All right. So there's a famous quote that says, the joy of competition is in the process of learning, not in the outcome. We as physiotherapy students, right, we have a very exciting world of physiotherapy out there for us, right? So make sure that through this competition, you are learning something. It is a competition, yes, but take it as a learning opportunity as well. All right. All right. So the first round is anatomy of answers. Let's look at the rules. Each team will get 20 seconds to answer after the question is read out. Correct response will fetch you 10 points. Incorrect response or time up, you will not get any points. All right. Decision of the quizmaster will be considered final. Kindly answer only when the question is asked to the team. All right. So I have already told you that I will announce which team is supposed to answer. Okay. And which team is supposed to not like which team is supposed to answer, right? Are there any doubts in the rules? If anything, you can ask right now, not in between the round. Okay, there will be 2 rounds of questions given to each of the team. All right. Shall we start? Okay. So the first question is going to be to team A. This is your question. Which ion is primarily responsible for the depolarization phase of an action potential? Your time starts now.
Ma'am, option B, sodium.
That's correct. 10 points to team A. Team B. Team B, are you ready? All right. Are we ready? Team B, kindly unmute yourself and say yes. Team B, kindly unmute yourself and say yes.
Yes, ma'am.
Thank you. So the next question is for Team B. The masseter muscle is innervated by which nerve? Your time has started, Team B. Can you be a little louder, please? Time up. The correct answer is trigeminal nerve. All right, next question is for Team C. Just a Team C, are you ready?
Yes, ma'am.
Okay. Which type of cells in the cerebellum are known for the inhibitory influence on the output neurons? Your time starts now. Your time is up. The correct answer is option A, Purkinje cells. Sorry? Hello? Team D.
Yes, ma'am.
Yes, ma'am.
Why can't I remove them? Team D, are you ready?
Yes,
Yes.
ma'am.
Can you please be a little louder?
Yes, ma'am.
All right. Team D, this is your question. According to the pain gate theory, where is the gate located that controls the transmission of pain signals to the brain? Your time starts now.
Slide is not visible. Spinal cord. A.
That's correct. 10 points to Team D. Team E.
Yes, ma'am.
All right. Are you ready?
Yes.
Okay. Is the presentation visible to you?
Yes.
Okay. This is your question. The tract of Burdak is also referred to as. These are your options. Your time starts now.
Fasciculus gracilis.
That's incorrect. You lose 10 points. The correct answer is fasciculus cuneatus. All right. Now, again, the next round of questions will start. Team A, please be ready.
Yes, ma'am.
Okay. So the next question is to Team A. In a basketball jump shot, which of the following muscles contributes significantly to the explosive upward motion of the jump? These are your options. Your time starts now.
Ma'am, A. gastrocnemius.
That's correct. Team B,
Yes, ma'am.
Okay, the next question is for you. In the context of a patella tracking disorder, which muscle imbalance is most commonly implicated? These are your options. Your time starts now.
Ma'am, option A, weak quadriceps and tight hamstrings.
That's incorrect. Also, your time is up. The correct answer is B, weak vastus medialis oblique, that is VMO, and tight ITB. Team C.
Yes.
Team B, kindly mute yourselves. Thank you. Team C, are you ready?
Yes.
Okay. This is your question. During a side plank exercise, which of the following muscles provides the primary stabilization of the trunk? These are your options. Your time starts now.
Ma'am, option D, internal oblique.
That's incorrect. The correct answer is gluteus medius. Team D.
Yes, ma'am.
Okay. Is the presentation visible to you? All right.
Presentation is
Okay, this is your question. What is the primary role of ADH, that is antidiuretic hormone? These are your questions. These are your options. Your time starts now.
Ma'am, increase watery absorption. Option C, increase the watery absorption in the kidneys.
That's correct. Next, Team E. Are you ready?
Yes.
Yes.
This is your question. In the context of a... So sorry. All right. I'm so sorry for the glitch. किधर है tiebreaker? Okay, Team E, this is your question. Which type of earthing is commonly used in residential buildings? These are your options and your time starts now.
Plate earthing.
Sorry?
Plate earthing. A option.
A. That is incorrect. The correct answer is pipe earthing. So with this, we come to the end of the first round. At the end of the first round, Team A is at 20 points. Team B and Team C have not answered any correct answers, so they are at 0. Team D is at 20 points and Team E is at 0 points. Okay, so now we have a tie between B, C and E. So we will play a tiebreaker question. All right. So can Team B be visible to me, please? Hello, Team B.
Ma'am, our camera is on.
Sorry.
Yes, ma'am.
Yeah. So Team B, C, and E kindly understand the tiebreaker. So I will be giving you a word, all right, an alphabet, not a word, an alphabet, and from that, in 30 seconds, you have to name as many terms related to physiotherapy or medical. Okay. The team with maximum, two teams with maximum numbers, first and second, will go to the next round, and the team with the minimum number of words will be eliminated. All right, is it clear? Team B, C, and E.
Yes, ma'am.
Okay. Team A and D, meanwhile, you can switch off your camera if you want to discuss anything. It is extremely distracting. Okay, so Team B, are you ready?
Yes, ma'am.
All right. Your word is your alphabet is F. 30
Yes,
seconds
ma'am.
starts now. Letter F.
F.
You have to tell the answers here.
Fragile. Facial nerve. Then fragile facial nerve. Femur bone.
Your
Fracture joints.
your 30 seconds have ended. Your 30 seconds have ended, and you have answered 3. Okay. All right. All right. Team C, are you ready?
Yes, ma'am.
Okay. Your letter is letter R. Your time starts now.
Reckless femoris, rehabilitation, Romberg side,
Rheumatoid
radial nerve, rheumatoid arthritis, radiology,
Romberg sign.
Romberg sign is done.
Okay, 6.
radiculopathy,
Retina.
retina,
8.
radius,
Radius.
radius,
Your time is up.
Rectus abdominis.
Your time is up. Thank you. You have answered 9. All right. Team E, are you ready?
yes,
Yes.
All right. Your letter is letter G.
G,
Start.
gluteus medius, gluteus maximus, gluteus minimus, gracilis, granulosa cells, geriatrics, germs, germinal layer, gums,
Gums. Okay.
gastrocnemius,
Okay.
then Goliath cells,
Galvanic current.
gangrene,
Gangrene.
Your time is up. You have answered 12. All right. So the team with the least number of answers is Team B. Unfortunately, you are eliminated from the first round and from the pre-qualifiers. Thank you so much for playing with us. And I hope that next time when we do organize the quiz, you will join us again. Thank you so much for playing. And you can leave the meeting. Thank you. we have team A, C, D, and E. All right. Now we'll move on to the second round. The second round is beyond physiotherapy. Okay. So again, we will have 2 rounds of questions. All right, 2 or 3 rounds of questions, and we'll see the round rules in a few minutes. All right. All right, teams. Can I please see your video? Yes. All right. Is the screen visible to you all? Okay. I can see someone nodding their head. Okay. All right. So round 2 is beyond physiotherapy. Again, let me remind you that the points that you have scored in the previous round will be carried forward to the second round. Okay. Not the tiebreaker questions, only the points from the round. All right. Is it clear? Okay. Now, for beyond physiotherapy, these are the rules. Again, you will get 20 seconds to answer after the question is being read out. Correct response will give you 10 points. Incorrect response or time up, there are no negative marking. Decision of the quiz master is final, and kindly answer only when the question is asked to you. Is it clear? Are there any questions, any doubts? All right, let's start. The first question is to team A. This is your question. Name any 2 authors of this book. The time has started.
Ma'am, O'Sullivan.
Okay. You have to name 2 authors.
Yes, ma'am.
Your time is up. Sorry. You did name one of the author, but you did not name her full name. The answer is Suzanne O'Sullivan and George Falk and Thomas Schmitz. All right. Team C. Are you ready?
Yes, ma'am.
Just a minute. All right. Team C, can you please unmute yourself?
Yes, ma'am.
All right. Team C, this is your question. What is the name of the book displayed? Your time starts now.
Therapeutic exercise. Therapeutic exercise.
Can you be a little louder?
Therapeutic exercises and rehabilitation.
Is that your final answer?
Yes.
Yes.
Okay. The answer is incorrect. The name is only therapeutic exercises, no rehabilitation. But that was a good attempt. Next, Team D, are you ready?
Yes, ma'am.
Yes, ma'am.
This is your question. Name the book displayed on the screen. Your time starts now. Team C, please mute yourselves.
Principles of exercise therapy.
That's correct. Team D, you get 10 points. Team E.
Yes, ma'am.
can't I see you? Team E. I can't see team E.
We are here.
Yeah. But I can't see you in the screen. Team E, is the PPT visible to you?
Yes.
Okay. This is your question. Name the book displayed on the screen. Your time starts now.
Fundamentals of electrotherapy.
By Low and Reed.
That's incorrect. The correct answer is Electrotherapy Explained, Principle and Practice. All right. Now, this round will definitely remind you to go and read back the titles of your books. I'm sure they will. It will. Anyway, so going on to the next round of questions in the same round 2. Team A, are you ready?
Yes, ma'am.
Okay. This is your question. What does CDC in the displayed logo stand for? Your time starts now. Your time is up. Anybody else wants to try? CDC, what does CDC stand for? Any other team? You will not fetch any points, but
Team
yes,
E,
Center for?
Disease
That's
control.
correct. But it is still half. CDC completely fully stands for Center for Disease Control and Prevention. But good attempt, Team E. All right. Next question is for Team C. Is Team C there?
Yes.
Is the PPT
Yes, ma'am.
visible to you?
Yes, ma'am.
Okay. This is your question. With which association is the displayed logo associated? Can you please unmute yourself, Team C? Your time has
Yes.
already started.
World Health Organization.
That's correct.
WHO.
WHO. This is the logo for WHO, World Health Organization. Okay, next, Team D, are you ready?
Yes, ma'am.
All right, Team D, this is your question. With which association is the displayed logo associated? Your time has started.
UNESCO. UNICEF. UNICEF. United Nations.
That's correct.
Children's Emergency Fund.
That's correct. The associated logo is UNICEF. Team E, are you ready? Is the PPT visible to you?
Yes.
Okay, this is your question. With which association is the displayed logo associated? Your time starts now. Your time is up. Anybody else wants to try? Anybody else wants to try? All right, I'll give you a hint. The association, it is related to sports, and they conducted a game right now. Or I think it is ongoing.
Is it Paralympic.
Yes,
Going
this is
on
the
to say.
Paralympics Association. All right.
It's not-
So this logo displayed is associated with Paralympic Association. All right. Now we move on to the scores. All right. At the end of round 2, we have Team A at 20 points, Team C at 20 points. Sorry, Team C is at 10 points. Team D is at 40 points and Team E unfortunately is at 0 points. So Team E, thank you for playing. You have been eliminated in this round. I hope that next time when we organize, you do come and join us again. Thank you so much for playing. I hope you learned something. You can leave the meeting. Thank you. All right. Now we have Team A, Team C, and Team D. Congratulations to you for going into the second round. Sorry, in the third round. We'll get back to the third round, which is reel, rhythm, and rally. I will let you know the rules as we go forward. So this round, which is round 3, is going to be kind of like a semi-final round for you. The team with 2 teams with maximum points will go into the final round of the pre-qualifiers. Okay, so to give you an advantage and for you to score more, we have not 2 but more than 2 rounds in this round 3. That is reel, rhythm, and rally. Okay, let's see the rules. All right, so round 3, is it visible to you all? All right, so these are your rules. Each team will again get 20 seconds to answer. Correct response will fetch you 10 points. Incorrect response, 0 points, no negative marking. No image will be passed forward. Decision of the quiz master is considered to be the final decision. So there is going to be a series of images displayed with a question associated with it. You have to answer the question correctly. All right, are there any doubts? You are getting 20 seconds. Let me clear this up with you all. You are getting 20 seconds to answer, okay, for each of the image, and make sure that you are discussing amongst yourself and answering only once. If there are multiple answers from 2 or more of the group members, your answer will not be considered. Is it clear? Is it clear?
Yes, ma'am.
Okay.
Yes,
So
Yes, ma'am.
let's move on to the round 3. So we have the first question is for team A. We have team A, C, and D. Is that correct?
Yes, ma'am.
Okay. So first question goes to team A. This is your image. You have to identify the image. Your time starts now.
Ma'am, below knee prosthesis.
Can you be more specific, please? Your time is up. So it is a below knee prosthesis, yes, but it has a specific name which was expected. This is called as Jaipur foot. Okay. So the correct answer was Jaipur foot. Next, team C, are you ready?
Yes, ma'am.
All right. This is your question. Identify the image.
Knee, ankle, foot orthosis.
That's correct. You get 10 points. My God, how relieved they are. All right, team E, team D, are you ready?
Yes, ma'am.
All right. This is your question. Identify the image.
Knuckle bender splint.
That's correct. Team D gets 10 points. Team A, are you ready?
Yes, ma'am.
All right. This is your question. Which method of application is shown in the image? Team A,
And coplanars of SWD.
that's correct. You get 10 points. Next question is for Team C. Are you ready?
Yes.
All right. This is your image. Which method of application is shown in the image?
Paraffin wax bath immersion method.
That's correct. You get 10 points. Team D, are you ready?
Yes.
ma'am.
This is your question. In which electrotherapy modality is the device shown used? Your time starts now.
Infrared radiation.
That's incorrect. The correct answer is SWD, shortwave diathermy. These are called as disc electrodes. All right. Team A, are you ready?
Yes, ma'am.
This is your question. Identify the equipment shown above. Your time starts now.
Ma'am, pelvic stabilizer.
That's incorrect. Anybody else wants to try? Any other team wants to try? Any other team wants to try, or I will tell the answer? All right. This is a perineometer. This is called as a perineometer. All right. Team C, are you ready?
Yes, ma'am.
This is your question. Identify what type of instrument is used in the image. Your time starts now. Time is up. Anybody else wants to try?
Whole.
BI.
Yeah, it is
Body
a
impedance.
BI. Can you tell the full form, please?
Body impedance analyzer.
Bioimpedance analyzer. Okay, so this is a BIA machine. This is going to give you a lot of information about fat percentage, muscle mass, your BMI, your BMR, everything. Okay, next question is to Team D. Are you ready?
Yes.
Yes, ma'am.
Identify the above shown device.
Humidifier.
That's incorrect. This is called as a Hudson's chamber. Okay. Team A, are you ready?
Yes, ma'am.
All right. This is your question. Identify the finding displayed in the X-ray. Your time
Ma'am,
has already
posterior
started.
dislocation of the shoulder joint.
That's correct. It is a posterior dislocation shown of the shoulder. It is also called as a bulb sign. Okay. Team C, are you ready?
Yes.
Yes.
Right. This is your question. Identify the fracture shown in the X-ray. Time has already started. Five seconds
Radius
remaining.
fracture. Radius fracture.
That is very ambiguous. Your time is up. Anybody else wants to try? Any other team?
It's fracture.
Ma'am, Kohli.
That's correct. It is a Colles fracture because it is at the distal end of the radius. Radius fracture, you were right, but you had to be more specific. Okay. All right. Team D, are you ready?
Yes, ma'am.
This is your question. Identify the condition shown in the image. The time is already started.
Pneumothorax.
Team D, you were not supposed to answer. You were
said
done.
it's for
I said Team D. Please mute yourselves.
we are only team D.
What are you answering? Sorry. Pneumothorax?
Yeah.
Hello.
Yes, ma'am.
Okay. It is wrong. The correct answer is pleural effusion. The correct answer for this image is pleural effusion. More specifically, if the markings were there, then right side pleural effusion. Okay, so at the end of round 3, we have team A at 40 points, team C at 30 points, and team D at 50 points. So unfortunately, team C, you have been eliminated. And thank you for playing. Make sure that next time if we organize this, you do join, and I'm sure you have learned something. Thank you so much for your participation.
Thank you, ma'am.
Thank you, ma'am.
You can leave the meeting now. Thank you. All right. So with this, we come to the finale or final round of the pre-qualifiers, Team A and Team D. If like I'm sure you are aware, the final round is the lightning round, right? So we will have rapid fire questions for you. Okay, they will be displayed on the screen. You are supposed to answer one correct answer. You will be given a time of 90 seconds to answer as many questions as you can. Each correct answer will fetch you 10 points. Okay. Okay. All right. So the final round is the rapid fire round. These are your rules. Each team will get 90 seconds. All right. Each correct answer will fetch you 10 points. Okay. And at the end of the round, whichever team has the maximum score wins. Okay. Let me remind you, team A is at 40 points and team D is at 50 points. Okay. All right. Team A, are you ready?
Yes, ma'am.
All right. Your time starts now. According to WHO, what is the cutoff range for a person to be called obese?
24.9 kg.
That's incorrect. Which orthosis is used for treatment of wrist drop?
Focus splint.
Sorry?
Focus splint.
That's correct. Which outcome measure is most commonly used to assess disability in patients with low back pain?
OS3 low back pain.
That's correct.
Disability.
What serum lab test is the most accurate representation of blood sugar control for 3 months?
HbA1c.
That's correct. What is the primary function of a triode in electrotherapy equipment?
Next, ma'am,
You
next.
can pass the question if you don't know.
Next, ma'am, next. Pass the question, ma'am.
Criteria is used to classify PCOS.
Ma'am, pass. Pass.
What does the Hoffman's reflex indicate?
DVT. नहीं होमन चाहिए.
That's incorrect.
Next.
The knee joint ligament which gives restraint in the maximum directions is?
ACL.
Sorry?
ACL.
That's incorrect. Which condition occurs when nerve conduction is affected by diabetes? 5 more
Diabetic
seconds.
neuropathy. Diabetic
That's
neuropathy.
correct. Which international organization provided guidelines for physiotherapy practice during the COVID-19 pandemic?
Next, pass.
Your time is up. So out of 10 questions, you were able to answer 4. Team D, are you ready?
Yes, ma'am.
All right. I cannot see your team members. Is the camera on?
Yes.
Are we visible, ma'am?
Yeah, now you are. Okay, are you ready?
Yes, ma'am.
Your time starts 90 seconds is 1.5 minutes. Okay, your time starts now. How do you assess the motor function of the 11th cranial nerve?
Interlocking of the shoulders.
That's correct. Which spinal movement involves the patient bending sideways to one side and then the other side?
Pass.
What specific pulmonary function test result is typically reduced in patients with restrictive lung disease?
TLC is reduced.
That's
FEV1 by is increased.
Name of the condition that commonly occurs in runners in which runners presents with pain specifically over shin of tibia.
Osgood Schlatter.
That's incorrect. Prolapse of the bladder is known as?
Pass.
What is a positive Brudzinski sign indicative of?
Meningitis.
That's correct. During the shoulder apprehension test, what position is the patient's arm in?
90-90. So 90-degree abduction and 90-degree elbow flexion.
That's incorrect. Which breath sound is most indicative of fluid accumulation in the alveoli, commonly heard in the patients with congestive heart failure?
Growls or crackles.
That's correct. Dash is the age-related loss of muscle mass, strength, and function.
Sarcopenia.
That's correct. Which PNF technique can be applied to improve trunk stability in a patient with cerebellar ataxia?
Stabilization.
That's incorrect. And your time is up. कौन जीता? जीत क्या? कितने क्वेश्चंस दिए उन्होंने?
सेम ही क्वेश्चंस थे।
नहीं आंसर कितने बराबर है?
ज्यादा दिए थे इन्होंने।
All right. So at the end of the final round, Team A in the rapid fire answered 4 questions. Team B in the rapid fire also answered 4 questions. But since Team D already had 10 extra points, so the winner for this round and for the pre-qualifiers in Group 4 is Team D. Congratulations, you go to the final finale that will be held in the next week. And Team A, thank you so much for playing with us. And next time, I hope that you will join again. I hope you learned something as well.
Yes, ma'am. Thank you, ma'am.
Thank you.
Thank you. Thank you so much for playing both the teams. Team D, we'll see you in the finale. Congratulations.